Hi, everyone, and thank you for taking time today to join us for this webinar. We'll be talking about couples therapy in relation to billing insurance in general terms, just how to work with insurance companies on getting sessions paid for couples therapy. What we will not be covering is how to use your SimplePractice account or any questions specific to using SimplePractice. So Barbara is a private practice owner. She is not a SimplePractice employee, and I will be moderating this webinar. So if you do have questions about SimplePractice or questions specific to how to bill insurance within your account, you can visit support.simplepractice.com, where you can take a look at our library of resources, get in touch with a customer support team member, or attend one of our live classes. We have classes twice weekly specific to how to bill insurance within SimplePractice. The first thing I'll go over is what our schedule for today. We'll take a second to introduce myself and Barbara, who's my co-host here, and then we're going to take time to answer some of the questions that were submitted ahead of time. So we had almost 2,000 people register for the webinar, so we had tons and tons of questions to go through. So hopefully the ones that we included in the webinar really cover the wide breadth of topics. We'll be looking at coverage, coding, diagnosing, reimbursement, and documentation, all as it relates to insurance billing with couples therapy. And then at the end, I think we should have about 10 minutes to answer any follow-up questions or questions from the audience. All right, so I will take, this is Maggie speaking again. I'll take a second to introduce Barbara Griswold, who is my co-presenter here and author of Navigating the Insurance Maze. Barbara, as I said, is a private practice clinician with almost 30 years in private practice. She has taught over 100 workshops on insurance and documentation and provides consultations to therapists nationwide. You can contact her at theinsurancemaze.com and we'll get more information about how to get in contact with Barbara towards the end. But we're really lucky to have you here. Barbara, do you want to
Thanks.
say?
Yeah, thanks, Maggie. And I want to introduce Maggie. Maggie has been, let me see her slide. There we go. Maggie's been working in the healthcare industry for 5 years. She cares deeply about making health services accessible to more people. She's a partnership manager there at SimplePractice there. So to her, insurance education is a vital element of public health, and she believes strongly that empowering providers to take on insurance will open the door for many more people to receive care. So she and I have this same passion to see if we can get more people to have access to care through insurance.
Great. All right, let's get started. So couples therapy, this is a topic that we get a lot of questions about. I think there's a lot of gray area in this subject about what's ethical, what's not ethical, what's
Yeah.
covered, what's not. So let's get right to it. I'm excited to learn. First and foremost, we'll talk about coverage. So our first question comes from Kristen, and it's, I've heard insurance doesn't usually cover couples counseling. Is that true?
So let's dive in. This is the deep end question here, so we may take a little time on this slide. Uh, I debate therapists all over the country about this issue. I have seen therapists' website, people who specialize in couples counseling, and right on their website, it'll say, you know, I do couples counseling and that's just not covered by insurance, so you're going to have to pay me out of pocket kind of thing. You know, I really disagree with that kind of presentation, and here's why. Most insurance plans will cover couples counseling. It's about what's the definition of couples counseling. So they will cover if there's two people in the room, and we're going to talk about the conditions, but the idea that bringing in a partner or having two people in the room working on a relationship automatically precludes insurance coverage is absolutely false. And in my mind, when you present that couples counseling is not covered, that is not only a disservice, but it's actually wrong information that you're giving to people who've paid a premium for this coverage, and you're telling them they will not be covered. So what I think it's more important to take the idea is couples counseling, when I use it today, just means when there's two people in the room who have a relationship. It doesn't, we're not talking about the content of what's going on. Now, insurance plans are going to make a decision about coverage based on the content of what's being discussed, not how many people are in the room. Now, having said that, I do have some clients, almost every client I have is covered for couples counseling, but I do have some that are absolutely not covered for any type of coverage, excuse me, any kind of two people in the room type of CPT code for family or couples therapy. So even within the same company, let's say Anthem Blue Cross, I could have a lot of Anthem Blue Cross clients who are covered, and then I have this one who specifically on her account is not covered. So you can never make any assumptions. We always go back to that with insurance plans. So always call the plan. And you want to call the plan and ask them not, is couples counseling covered? Because they'll say no sometimes. But you want to ask them, is a CPT code, which we'll talk about a lot later, 90847 covered? That's the one for family and couples. You know, is that covered for a client or a member who has a diagnosis? So we'll talk more about that whole idea. But don't ever ask a plan if couples counseling is covered, because they often will say no when it actually is in certain circumstances.
Great. So, and we're going to look at actually some scenarios too, so that we can, because I think what's important is nothing is definitive. You can't say no flat out.
Right.
So let's see, when is couples therapy covered?
Right. So in some ways it's the same as individual. Their insurance requires that they need to believe that the topics that you're talking about are is medically necessary, that the treatment is medically necessary. That is their little buzzword. So first of all, what's medically necessary? Well, somebody in the room has to have a diagnosis. That's true with individual therapy for them to cover it too. And it can't just be usually a Z code, a DSM-Z code, like partner relational problem, okay? If that's all that there is, they probably insurance usually will not cover it. They also might not cover just a sexual dysfunction issue or a sexual desire issue. So something like that, they might not see as necessary. So medically necessary, you know, it has a whole criteria, but usually it needs to be a diagnosis of something like that. So one person in the room has to have a diagnosis. There needs to be some level of symptoms or impairment from those symptoms. They basically just, it can't be growth oriented. If it's just somebody coming in and this couple just wants to kind of talk about how to have better communication, if that's it and there's no diagnosis in the room, that may be something that they will not cover. So just like make a note of that. But you know, a lot of people call up and say, I want to do couples counseling. But when you get in the room, so you think to yourself, oh, this is not going to be covered. But when you get into the room, you find somebody's anxious, somebody's got depression, somebody's got a substance abuse issue. So to me, I never know if a couple's going to be covered until it doesn't matter what they say to me about why they're coming. I need to make some clinical determination when they get in the room to see whether it is medical necessary treatment in the eyes of the insurance plan, and whether I can ethically bill the insurance plan for that.
Yeah, so it might not be something that you can even answer until after the intake, but
right.
So our next question is, I've been told that one person in the couple has to be the identified patient. And I think I've heard a few different words used for this term, primary patient, designated patient. Is that true? And we'll talk more about how that works.
Yeah, you know, and this is a big issue I hear. Again, I do a lot of debates with people across the country, but a lot of therapists are like, hey, that's not how I look at my couples. The couples I work with, I see it as a system. I don't have an identified patient. I don't like having to choose an identified patient. Do I have to? For insurance, somebody's name has to basically go, and this is how I tell the clients, somebody's name has to go in the claim form in the patient a box, basically. They don't really have a way of billing. They haven't figured out a way to bill for couples that makes both of them, you know, equally. They just haven't figured that out. So yes, in terms of billing, somebody has to be the identified patient, and that person has to have a diagnosis. And that person obviously has to be covered by the insurance. So like if you have two people coming in and only one of them is covered by insurance, and that person has no diagnosis, you really can't bill their plan, right? So yes, there has to be an identified patient. What I would say is, that's just for billing, is that most of us don't see our clients that way, that one of them is the identified patient and one isn't. I think you can hold both of these, a clinical view of the couple and a billing view of the couple. I
Yep.
think that, and insurance plans know that. Insurance plans are not stupid enough. When you do a clinical review, they don't, they know that you see the system, and it's okay to talk about the system a little bit, but they are going to want to hear how the identified patient,
Mhm.
diagnosis is being treated by you in those sessions. So maybe I'm doing communication work with the client, the identified patient, and his husband, in order to reduce depression, or in order to increase the responsiveness of that partner to the depression. So we'll talk more later about what are some good goals that insurance plans support,
Mhm.
for you to do couples counseling.
All right, and let's look at the second most important question is how do you choose the identified patient? And do you default to the insurance or how does that work?
Well, pretty much no. The bottom line is, clinically, you never should make any decisions based on, well, you have the better insurance, so I'm
Mhm.
gonna like create a diagnosis for you so we can bill your insurance. No, obviously ethically, I assume that Ben's question is, what if both of them have a diagnosis, and and they both have coverage? Like, how do I choose this? Now, I think many of us are just not comfortable with the idea of identified patient, also clinically, because, these couples sometimes come in already kind of saying one person is the fault, is at fault for all the family problems, and is there going to be some clinical ramifications of saying, well, you're the identified patient? Um, that's why I kind of explain this to clients, like, hey, I see you as a couple that it's a dance and you each have your
Mhm.
steps in the dance, but in terms of insurance, we just need to put somebody's name there. Sometimes I even say to them, hey, you both have some issues going on for you. Is there a reason why you might want to put one of your names versus the other? I've had situations where the wife has said to me, like, no, he needs to be the identified patient because I have a high security job. I am concerned about confidentiality, or I don't want to leave a paper trail, whatever. And the husband was like totally fine. He was like, yeah, that's fine. I don't
Mhm.
care. I just want the treatment.
Yeah.
As long as you can ethically stand behind and defend your diagnosis, of a person, and that means, and we'll talk about later with documentation, your notes are going to have to skew a little bit more toward that identified patient. If you feel comfortable with that, then choose whoever you wish. I tend to choose, if I have total freedom, I tend to choose the person who has the more severe diagnosis, because that
Right.
will give me probably more sessions with that person, that couple,
Mhm.
if needed.
Yep. More to back in terms of medical necessity.
Yeah.
Um, okay, so does the couple have to be married? And this was actually a question I saw a few times. I have couples who live together who have different insurance companies who want couple counseling.
Yeah, for most cases, the answer is no. It may vary, between some, and you could have to look into the exact insurance plan and see exactly who, but for the most part, insurance plans don't care what the relationship is. It could be a gay couple, it could be a premarital situation, it could be dating. They don't really come in and say, oh, we're not going to cover that because you've only been together 2 months, or we live together, oh, you're not married, or you're domestic partners. They really don't have a lot of rules on that end. It's more about, what are you talking about in session, and do we think it's medically necessary treatment?
Hmm. And in that case, you would A, pick the identified patient, but B, also verify both. I mean, you want to verify the identified patient's insurance. It doesn't really matter who the other person's insurance is. Is that
Right.
understanding?
Just make sure that the person you're billing for, like, is covered. That's
Mhm.
number one, and that they have a diagnosis. Those are the two main things. Yeah.
Okay, so can we bill when one partner has insurance and the other does not?
Sure, and this kind of comes back, if the partner that you're billing for is covered and has a diagnosis, comes back. So the other person you can have an uninsured person getting tons of treatment from you, but it's being billed through their partner, and that partner has the diagnosis and they're the identified patient and they're covered. So absolutely, if I'm understanding that correctly.
So my understanding is diagnosis is the most important. So the insured would have to be the identified patient with a diagnosis. If that happened to be the uninsured person and
Right,
then there was no diagnosis for
right,
the insured person, then that would
right.
not be ethical.
So, right, if we have Susie and Ken come in and Susie has no insurance, Ken does, but Ken is having no symptoms. Susie's like really depressed. Well, I can't bill her insurance, right? She doesn't have any. And I can't bill Ken's insurance because there's nobody covered here who has a diagnosis. I can't bill a 90847 even, which is the code for a couple session, to him because there's no diagnosis. So you have to have both of those pieces. The covered person has to have a diagnosis.
Yep.
And yeah.
Or otherwise that would be an out-of-pocket session for a couple.
Yep.
All right, so last question in the coverage area is, what are some treatment goals that insurance would support doing couples therapy? And we have actually broken this down. Do you want me to just jump to the next slide?
Well, let me just say a minute. A lot of people think that insurance is very strict about I can only bring the partner in under very strict circumstances. But I was able to find this on a Cigna website, and I think that most insurance plans would agree with this. I've seen a couple other ones, so I printed it out on the next slide, like what they said about when they would support couples counseling for what treatment goals. So yeah, next slide, please. So they said that it would be okay to do couples work when you need to address relationship issues, if it's contributing to the identified patient's symptoms or lack of functioning, to provide education to the partner to improve the identified patient's compliance with therapy goals, to assist the partner to understand the identified patient's symptoms, to address the behaviors, and to respond more effectively, to reduce the negative impact of the identified patient's condition on the partner, which fascinated me. They cared enough about the partner, who isn't even their member, possibly, to just bring that partner in and try to reduce the negative impact of the identified patient's symptoms and how they're affecting the partner, to assist in the diagnosis or treatment planning for the IP. So sometimes you're just bringing in that person kind of more as an informant to the treatment. Or if you believe that this is going to speed the identified patient's progress in treatment. So you can see this is kind of a wide range of reasons. Now I wanted to give you these words so that if you're ever in a treatment review situation where somebody calls up from the plan and says, why are you doing couples counseling, or what are some of your goals with doing couples counseling versus individual? You got the lines right here. I'm bringing in the partner so that blah blah blah, and all of these are great answers.
And I should have mentioned this at the start. We are going to send a recording out of this webinar to everyone after the fact. So if you want to take a screenshot of this, or if you want to wait, you'll have a chance to watch this back and write these down or make note about what some acceptable goals are.
Yeah.
And then the next section, let's get into some fun stuff, depending on what you think is fun. We're going to talk about coding, and I think this is a bulk of where confusion comes from, a lot of questions about how to actually submit a claim for couples therapy. So let's get right into it. We'll talk about some different scenarios here, but what CPT code should I use for couples therapy?
So what I decided to do is put together a little quiz to see if you guys, where you're at right now, whether you understand, and then we'll talk about each one at the end. So let's advance the slides. Let's look at some different scenarios here. You've met with this couple, you're gonna meet with this couple 4 times, and I'll see if you know how to code these various situations.
Okay, so our first let's look at the following scenarios. And if anyone wants to participate, you can you can write in a response in your question box on the webinar.
Yeah, we'll see how good you guys are at naming these beforehand. Okay,
Okay,
so see the couple together for an intake. What is the code, CPT code? Now remember, CPT codes are those 5-digit codes that you use to tell the insurance plan what kind of session it was. So if you see the couple together for an intake session, what is the code that you use?
And I think some people guess 90791. We'll actually answer them at the end, but let's go to the next.
You see the identified patient alone.
And the guesses here are 90834, 90837. Some of these might just sound like numbers to people.
We'll talk about them at the end.
Yep.
You see the partner of the identified patient alone.
Then could you use a 90837 for this session? That's a question that has come up.
Yeah, okay, question, good question.
Let's look at our
Session
final.
4. Yeah, you see the couple together, bring them together. So you've done one each with each one of them after the intake, and now you see them together.
And I'm seeing a lot of different debate about this one, whether or not this can change based on the length of the session. So I'm seeing 90846, 90837, 90847. So
I'm glad we're
without
doing
further
the webinar.
ado.
I'm glad we're doing the webinar because 3 out of 4 of those is wrong.
All
Okay.
right.
All right, so let's look at the answers. All right, so the first session, couple intake, slam dunk, that one's always going to be in 90791. So a lot of you got that one right, sounds like. The word intake should be your cue. Doesn't matter if it's a couple intake, any kind of intake, any kind of diagnostic assessment for the first session is going to be a 90791. There's history taking. It's different than a regular psychotherapy session. So 90791 sounds like you guys got that one. Number 2 session where you just saw the identified patient alone. It sounds like you actually kind of got that one right. This is where you would do the 90834, the 90837, depending on the length of time that you meet with the person. These are individual therapy codes, and since he's your identified patient, no, I think it was she, was your identified patient for that session, you're using an individual therapy code. Now, a lot of people don't know that they continue to use a couples therapy code, but there's only one person in the session. And even though it's that session is kind of in service of the couples therapy, that session you're telling the insurance plan was an individual session. Now, just to note here, the 90834 is technically a 45-minute therapy, it's called, but it's more technically, the time range is 38 to 52 minutes. And the 90837 is called 60-minute therapy. It could be used for individuals 53 minutes and over. I should say here that people have gotten really confused about this. People think that you can use these. We're going to talk about that later. No, we're going to talk about that later. All right. So session 3, you see the partner of the identified patient alone. Hopefully this one was clear. Whenever you do couples counseling without the client present, so you're seeing the partner, a family member, 90846. And that was recently, a couple years ago, added a time range to 50 minutes. And then you see the couples together, and this one seemed like it had the most confusion. That's going to be your straight 90847. That hasn't changed in 30 years. Whenever you just see the couple together, it needs to be a 90847. We're going to talk about later for those of you who thought maybe it would be a 90837 or 90834. Why not? We'll talk later about that. But basically, a couples therapy session where where the client's present and the partner's present is, going to be ongoing sessions, particularly are going to be a 90847. And again, that code is also 50 minutes. And we'll talk a little bit later about what about longer sessions too.
And
What I
think is really interesting is having to change the way that you're thinking about when you look at the couple and then when you're actually billing insurance. So when you see the partner of the identified patient alone, you might not be dismissing the fact that that person could have a diagnosis too. Like that's what I wanted to talk about, is if the partner of the identified patient and you're seeing them alone, that person may have a diagnosis, but that's not the diagnosis that's going to go on the claim form.
Right. And you have to think, if sometimes people see both members of the couple individually, ongoingly, that's a different situation. You're going to be using individual codes for those sessions, and that session, they're the IP, they have a diagnosis, you're billing insurance for them under their name. It gets very complicated. But for most people, if you're just doing couples work together, and maybe occasionally you do a one out with the identified patient, which a lot of people do, and maybe one out with the identified partner. Excuse me, the identified partner, the partner. This is how it would bill. So
And we'll get into some more questions.
We'll get into. Let's move on, because there's.
Yep. Okay.
This brings up a lot of other questions.
So our next question is, I do 60-minute sessions with couples, and my client's plan pays more for 90837. Can I use 90837 instead of 90847 for these sessions?
So this is probably one of the biggest mistakes people make coding couple sessions. And why is that? Because back in 2013, when all the coding changes were made, the new codes that came out, the 90837 and the 90834, the description was therapy with or without family member. So it seemed like you could use these codes, 90837 or 90834, for family sessions or couple sessions. It was a very confusing name for an individual therapy code when it says with or without family member. So people started choosing the code they wanted to use, whichever was going to pay them more. They finally figured this out, and the AMA came back and said, wait a second, we didn't really mean that to happen. If you're doing ongoing couples counseling, you should use 90847. They changed the description for 90837. They took out with or without family. They took out that little descriptor, but some people don't know that, and they're still billing. So you can only use 90837 or 90834 for family sessions. If you're doing ongoing individual sessions, let's say with a kid, and you bring in their mom at the end for 15 minutes, that was their intention. Or you bring in maybe their mom once a month, but it's just to inform treatment, but you're primarily wearing the individual therapy hat. But if you're doing ongoing couples therapy, you don't touch these, you need to be using 90847 every time, except in the situations we just talked about, where you do a one-off session with one or one-off session with the other, and then you're going to be using other codes anyway. But does that hopefully make sense?
Yeah,
So
I think that's clear. So the answer
forward. You can't use the 90837, first of all, just because it pays more. That would be fraud. You're basically changing the code. That's misrepresenting the code of what you're doing. And you're saying that an individual session happened when actually a couple session happened. And so that's fraud, is whenever you misrepresent what happened.
Okay, so let's look at this next question. I'm seeing a couple who is seeking help dealing with their daughter's anxiety. I'm not seeing the daughter. Neither parent has a diagnosis. What CPT code would I use for their sessions? Could I bill insurance for this? Who would be the identified patient? This is a big one. It feels like one of those
it has a lot
problems.
of stuff. But basically the idea is, what if you aren't seeing the actual person in the family who has the problem? This actually came up for me. Somebody came in and their daughter had an eating disorder and was in an eating disorder hospital situation. The parents just wanted to deal with, their own, how to handle her, should they allow her to come home, in what situations. But they really didn't have anything that could amount to a diagnosis. They weren't having an adjustment disorder, they weren't depressed or anxious or insomnia. Now, I don't have an identified patient here. There's no one here with a diagnosis. I'm not treating the identified patient in the family, so I can't bill for 90846, which is the family therapy without the client present. I can't bill for that if I don't treat the client. Okay, so basically I can't bill the insurance for this. I don't have an IP here. I don't have one that I am treating. So,
This would be an out-of-pocket.
This would be an out-of-pocket, yeah.
All right, so our next question is, how do I code it if I see the client on the same day in an individual session and a couple session?
Yeah, and I think this question actually comes up later. Basically, can you treat somebody individually and couples? And whether the insurance plan will pay for it is something else. But the important thing to do is if you see a client on the same day doing an individual and then a couple session, which a lot of people do, is for the second service that you provide, you're going to add the modifier 59. And 59 tells the insurance plan that this was a separate service, separate and distinct. It's called service on the same day. It's not like two things that happened in the same session. They'll just kick one of them out. You're saying, I did two separate, different services in the same day, and I'd like you to consider them in that way. And they may or may not pay for that. Some insurance plans will only pay for a maximum of 50 or 60 minutes in one day of therapy, but try it.
Yeah, definitely something to verify with the plan. And for anyone who has questions about modifiers, those go to the right of your CPT codes, separate from the codes, and that is added to the claim form. All right. So our next question is it ethical to bill alternating clients when doing couples therapy?
If I understand this correctly, basically, I think they're asking if I have a couple, can I bill the first 6 sessions to the, one person's plan and the next 6 sessions to the next person's plan, or go back and forth? Like maybe they only allow 1 session a week and I want to do 2 sessions a week, so I bill every other session to each person's. It depends on the situation. I'd have to know more about exactly the situation that they're talking about, but I would say that if you are at all misrepresenting what's going on, then you should have a red flag going up. I always think whatever I'm doing, I try to imagine like if I got called into court to defend, why I was doing it, how well would I sleep the night before, right? Am I going to have to like make up a story about, well, yeah, on Tuesdays we were dealing with this guy's, that whole session was dealing with his treatment plan and his upset, and then on Thursdays we were dealing with her issues. Is that really what happened though? If I think I'm stretching what really took place, then I really don't think you should do it. So I think for the most part, I think it's probably not ethical to bill alternating clients, if that's what this person is meaning. Again, you kind of have to look into your are my notes an accurate reflection of what's happening in session? And you want everything to be kosher.
Yep. Oh yeah. When I think with insurance, it all comes down to medical necessity, right? So everything you need to be able to back in terms of was that medically necessary? Will they understand that?
Well, who is the identified patient too? Like,
yep.
Are you flip-flopping on who's the identified patient for each session? Is that actually what you're doing, or is that really not? Are you just doing ongoing couples counseling and you really aren't doing extra focus on one person?
Right. All right. And then another subject here we're going to get into is the actual diagnosis codes that are acceptable. And we've touched on this a little bit, but we've had a lot of questions. And the first being, can you diagnose both individuals of a couple?
Well, you're going to see, we all have seen a lot of couples who both have diagnoses in our own families too. But I don't see a reason. You might put that in your notes just for your purposes of treatment, but in terms of there's no reason, in fact, you don't want to put any more information on a claim form or an invoice than is necessary. So there's no reason to diagnose more than one individual. You pick an identified patient, you diagnose that person, and that's the diagnosis that's going to go in the claim form. I should say also that on the invoice, if you are out of network, don't even put the other person who was in the sessions. Don't put their diagnosis. You always put the minimum necessary to get reimbursed. Otherwise, it's a HIPAA violation to give extra information, and you're kind of breaching confidentiality potentially. So
that's a really good call out in terms of including the other patients demographic information on a claim form, it's not necessary.
Yeah.
All right, so the next question is it ethical to diagnose a couple if the issue is infidelity, building communication skills, or premarital counseling?
So this we kind of touched on in terms of you can be doing all those things. The question is not, it's not ethical to create a diagnosis. So I might be talking to somebody for infidelity, and some people, they don't have an anxiety diagnosis or depression diagnosis or an adjustment disorder diagnosis, but some couples are going to have that. So it's not ethical one way or another. It's ethical to diagnose a couple if they have a diagnosis. So again, you diagnose anybody who comes into your office that you can support the diagnosis. It doesn't matter why they're coming in or what you choose to do with them, but there needs to be someone in the room with a diagnosis, more than a Z code, as we said, or more than a sexual issue.
Yep, and that goes back to those goals and that we had talked about earlier.
Yeah.
That ought to be related to an actual diagnosis. Okay, so the next question is, I just give all of my couples an adjustment disorder diagnosis. Is that a problem?
Yes. This came up at one of my live workshops at one point, and I said, so you're telling me you've never seen anyone who had a substance use disorder, or you've never seen anyone who had an anxiety disorder, or you've never seen anyone with a depression disorder? It's not only a problem because it's not accurate, but if I were the insurance plan and I saw that every person who comes through, you give the exact same F4323 adjustment disorder, I'd start to question whether you were just rubber stamping diagnoses on, and I might look more carefully. So I think it's more of a problem, first of all, because it's not accurate. And second of all, it's a problem because it might draw the attention of the insurance plan. It's also a problem just because, let's say you're dealing with somebody who has major depression, but you don't want to write that down. You write down adjustment disorder with depression because you think that you try to go with the innocuous. Well, then 6 months down the line, let's say they do a treatment review and you're trying to tell them how depressed this client is, and they're like, I don't get it. You just gave them an adjustment disorder. You've kind of tied your hands in terms of defending ongoing treatment for this couple, and so I really try to be honest and forthcoming and list all the diagnoses that the client has. Don't just like say, I'm going to hide the fact they have a substance use disorder. I'm only going to put down their adjustment disorder, which is real. You really have to, it is kind of fraud to hide diagnoses also from an insurance plan, because if they had made if they had known all the diagnoses that were present, they might have made a different reimbursement decision.
Definitely. And before we move on to the next subject, I wanted to touch on another term that we've been throwing around, which is Z codes, and why those, what are Z codes, and why wouldn't an insurance consider covering those in a lot of examples?
Great question. So in the old DSM-4, they were called V codes. So a lot of people are more familiar with that. DSM-5 changed them to Z codes, not sure why. And again, these are kind of more phase of life issues, like we said, partner relational problems, in-law problems, could be just things that everybody has going on in their life. And I can't think of some great examples, but anyway, they are saying, look, for a person to use their medical insurance plans are saying there needs to be a medical disorder present. There needs to be a medical symptom present. And you having trouble with your in-laws or with your husband does not necessarily mean that you should be able to use your medical insurance. So that's what we have to keep remembering when we talk to a treatment reviewer on the phone. If you ever get reviewed, you're talking to someone who's reviewing you more like a medical, and you have to speak that language of symptoms and impairment. How is this new baby impairing them? Oh, he's having trouble sleeping and having trouble concentrating, and he's having trouble, he's more irritable, and he's fighting more with his wife. So you have to be able to talk impairment, symptoms, and medical, insomnia, whatever. So address those things versus self-esteem. They don't, self-esteem is usually not a covered, so it's a growth-oriented thing.
And that differs a lot from employee assistance programs, which is something we're not discussing here, but those are generally more lenient, in my experience, with Z codes, EAPs.
Right.
That aren't necessarily reviewing the same way that a medical insurance or a specific insurance company will look at.
Correct.
Okay, so let's get into everyone's favorite subject, which is reimbursements. And our first question is, will we be reimbursed at a lower rate for couples therapy?
This is a fascinating question, because you would think with 2 people in the room and for the extra outside of session work you're going to have to do, like coordinating care with their different, they might have different individual therapists, they might have different doctors. There's just like more stuff that has to happen outside of session. And plus the complexities of treating 2 people versus 1, that we would be paid more. Some plans do pay a tiny bit more, but some plans pay less, which is shocking to me. And I've, gone back to a couple of these plans and asked for raises, and they're like, no. So I think their defense would be that these are 50-minute sessions versus 60-minute sessions for individuals. So if you compared 60-minute individual rates and 50-minute couples therapy rates, I think that would be their defense. It may also be that historically couples therapy has not been something that insurance supported in the past. So they just don't want to, they're not encouraging it as much as, perhaps individually, just historically. But yeah, you might be, is the answer to this one. You have to check.
And as we learned before, you can't use 90837 just because you get paid more.
Right. Yeah, that would be misrepresentation and potentially fraud.
All right, so will insurance pay for couples sessions that are longer than 50 minutes? And if so, how do I bill that?
Okay, so this is a big one. We're going to go through it a little quickly, and I have a link for you to get more about this. This is one of the biggest questions I get asked, because so many of you do extended sessions with couples. Maybe you're doing some type of longer Gottman, or you're doing some kind of EFT or something like that. So, okay, so let's say that you're doing an 100-minute session. Let's take some possible coding options, and of course there may be a few more, but don't forget that you can use crisis codes. If a couple comes to you in crisis and they're doing, these codes that some of you are familiar with, they're kind of new in 2013, I think. 90839 is the first 60 minutes of a crisis session. So if somebody's they call you up and say, we need to see you right away, and the session is just like all crisis related, and it's very high, adrenaline pumping, you need to refer them, whatever. If it's a very big, so a one-time deal here, don't forget to use a 90839 for the first 60 minutes, and then you have the ability to add on an add-on code of 90840 for each additional 30 minutes. I won't spend a lot of time on that, because for the most part, we're talking about what about ongoing longer sessions. Could you use a 90847 or a 90846, just one unit, even though it says 50 minutes? Yeah, the thing is that the idea is that you're going to code the same way for a 3-hour couple session as you would use for a 50-minute. I mean, they really aren't giving you other time choices that only give you that code, and it only says 50 minutes. So if you put down one unit, they're going to pay what they're going to pay, and no matter how long your thing was. So what about if you put 2 units down? Again, I think they're going to, most insurance plans will just pay 1 unit per day. So 2 and 3 are going to probably end up the same, that no matter how long your session was, they're just going to pay for 1 unit, no matter how many units you did. And when we say units, that just means how many 50-minute sessions you did. Can you bill each partner's health plan for a 90847? What if they're both covered? Could you say, the first 50 minutes I'm going to bill to your health plan, and then the second 50 minutes I'm going to bill to your health plan? Well, again, we go back to that thing about, well, is that really what happened in the session? Did we spend the first 50 minutes focusing on your diagnosis, where you're the identified patient, and the treatment was kind of focused on that. And then the second 50 minutes, we focused on yours. And do I have different treatment goals for each one of you? And do I have separate charts for each one of you? So, I mean, it's not impossible, but is the question I want you to ask yourself is it an accurate reflection of what happened? If so, then I'd say, yeah, that's a possibility. You could do that. But it kind of is going to be difficult because you're going to at some point have to write, and don't forget this is so important, so you're going to have to write start and stop times of the session. So if your documentation is that it started at 1 o'clock and it ended at whatever 3 o'clock, but now you're actually billing the plan for one person, it's going to be more like 2 back-to-back sessions. So again, if you want to set it up that way and you can ethically have separate charts and separate treatment plans, that's a possibility, but you'd have to kind of shift mid-session and start working a little bit more on the other person's treatment plan and how, you know.
Mm-hmm.
Now, this one's a little bit more likable to most people. If you're a network therapist, can you build a plan for the first 50 minutes and ask the client to pay the rest? Normally, insurance plans don't like you to bill the client for anything more. But in this situation, I've talked to a couple health plans and they said, well, but really insurance clients do have the right to buy more services basically than their insurance plan will cover. And if you get a signed private pay agreement with the client, basically saying, I understand that this is the first 50 minutes only can be billed to my insurance. I understand that I'm going to pay out of pocket for the rest. I understand that this is what I'm going to be charged for it. And I agree to that. That's what I want to do. I have a sample private pay agreement like this in my book and in my practice forms packet on my website. So if that's something that you might be interested in, either contact me or go to my website at theinsurancemaze.com, and you can look at my store page and see those things. Now, another option that's become available recently is called prolonged service codes for sessions over 80 minutes. These are a little spotty about being reimbursed, but basically they're a new thing that has become available. They used to be only used by doctors, and now they're open to therapists. And I'm just going to give you the link because it's a very lengthy discussion of these codes and how they are used. And this link here, theinsurancemaze.com/extended 90847 sessions, will kind of tell you all about how to bill for using prolonged service codes. Again, some people are getting them reimbursed, some people aren't, but it might be something worth trying. That
That's a
was
lot.
a long slide.
Take a deep breath.
Long slide.
Yeah, let's take a beat for everyone to take that all in. Let Barbara catch her breath.
Or get a screenshot if you want.
Yep. And our next question is, will insurance cover couple sessions if the individual client is also in individual therapy? This is something that we touched on a bit, but in terms of reimbursement.
Usually, yes. We can go to the next slide. Yeah, that's usually not a problem at all.
When I see a couple, can I bill each of their insurance plans for a couple session? And can I bill each for an individual session?
Okay, so you definitely cannot bill each for an individual session because you didn't do that, right?
Mm-hmm.
But you would be shocked how many people are doing this because they know that that's going to be covered. But as you can tell, the CPT code would be different than, you know, you're not billing for an individual session. This is a couple session that occurred. You need to use a different code. Can you bill the insurance plans for each for a couple session? We talked about that. You cannot, no, we didn't talk about that. This is saying just for a 50-minute session, can I bill them each insurance plan for that same session? No, that would be double billing for the same 50-minute session. The only time you can do this is if you submit to your identified patient's insurance, it gets paid to whatever portion, and then you bill the other person's insurance, but you include the explanation of benefits that says how the first one paid. So the second insurance plan knows that there's already been partial payment. So sometimes a client can get full reimbursement, or but the bottom line is you can't get double covered for the same session and get double payment.
And secondary insurance is a whole other beast.
Yes, it is.
that
We're not going there today.
No, that might be another topic. Okay, so last but not least, we'll talk about documentation. We just have a few questions on this before we can answer some of the questions from the crowd. So, how is documentation different for couples, and do I need separate charts for treatment plans for each?
Yeah, I mean, some therapists choose to keep separate charts and treatment plans for an ongoing couple. I would say most don't. Most keep a combined chart. It makes, otherwise you're writing two sets of, notes, two treatment plans. Typically, you have an identified patient. You have one treatment plan for that identified patient, and the partner is just participating in ongoing therapy in service of, and you're just, again, you're not saying the entire documentation has to be about the identified patient and how it's all about them and what they're, but you're going to just skew it a little bit to make sure that if you've given them an anxiety diagnosis, that running through your progress notes, there should be, oh, I taught them communication skills in order to help partner respond to Jenny's anxiety or client's anxiety.
Mhm.
So every once in a while, you're going to mention the diagnosis and how what you're doing is addressing it. But in every other way, your documentation, is just kind of normal. It's what you would do for an individual. So separate charts, I don't. Treatment plans, not necessary. But we're going to get to whose chart is it in the next question, I think.
And as we saw way back at the beginning with the goals, you don't have to, like, you can include the non-identified patient in that information as well. They're important too. Okay. Our next question is, so whose chart is it? Do I need a release signed by both clients to release information?
So this is going to vary depending on your state and your legal, but here in California where I am, pretty much you need a release signed by both clients to release information. And there's a discussion about whether even just to the insurance plan, do they need it, or just the identified patient. I would totally get a release at the start of therapy from all, both clients saying, that I might need to release to the insurance plan for these reasons and that reasons and these reasons. And it could be for a treatment review, could be for an administrative documentation review audit, could be anything. So get both of their, but basically if there's so many reasons why a client might say, I want my couples therapy notes. And for the most part, to be on the safe side, you need to not release until you get both of their a release from both.
All right, well, this is actually the end of all of our questions from the crowd. We have some freebies here from Barbara.
Yeah, I wanted to offer this to all of you who came today. I've got these two cool freebies, and you just have to contact me because they're just too cool. The first one is a fair fighting rules that I put together that I give as a handout to my couples clients and even some of my individual clients. But the other one is my telehealth door sign that I've put together. It's so easy. You just print it out on your computer and you cut out a little hole and put a little clip, and it's great for working from your home and telling people whether they can come in or whether they need to. I think it says if you're on fire. The last one is something like the only way you can come in is if you're on fire or bleeding. So it goes from come on in to don't come in unless you're on fire or bleeding. Anyway, also
And that's good for everyone. I think
yeah,
that's good for clients too.
or just if you want to take a nap and keep your family away from you. Also, just contact me at that same theinsurancemaze.com/contact just to get on my mailing list. I have some other great webinars coming up. I have a longer version of this one that goes into a whole extra hour of ethics with couples counseling and, what are some difficult secrets policies and when do you do that? And what about if a client shows up by himself without his wife at a session? Do you see them? And all these cool messy situations that we get in with couples. So please contact me and get on my mailing list. I'll tell you about some other great resources.
All right, so we have just a few questions I want to get to from the crowd today. The first one is, does insurance cover premarital counseling? And if so, how do you present the diagnosis?
Yeah, we talked about that right at the beginning, that it's not what you have to make sure that someone has a diagnosis first. So it's not whether they're doing premarital or whatever, but a lot of people coming for premarital don't have a diagnosis. They're just wanting to, talk about certain issues. So you can't bill insurance for premarital unless there's a diagnosis. And again, you would have to choose your diagnosis based on what you're seeing in the room clinically and what you can support.
Okay, and the next question, I'm not sure if I completely understand this, but let me ask it and see if you, so does the modality I use, emotionally focused therapy, make a difference in whether I can ethically bill insurance?
No, not at all. Again, whether they call you up in a treatment review and you still need to defend, it doesn't matter what you're doing as long as you can defend to the insurance plan how you think that is either helping, or that they're going to want some kind of evidence-based treatment. If you're just doing singing with the client and that's it, they may say, yeah, we don't think that that's a clinically supportable thing that we think is a treatment that is. But you're in the mainstream there. That's not something way off in the weeds. So no, they would certainly support that. Again, it's just a matter of you defending how that is helping this particular client and how it's furthering the symptom reduction. Your goals have to just be about symptom reduction in the client.
Okay, our next question comes from Kurt. If the therapist has both people fill out an intake, what do you do with the non-identified patient records or record?
Like I said, I combine all the information in the identified patient's chart. And again, that is a combined chart, so it needs complete both of their authorizations to release anything from there. So it gives an extra layer of security. So, I think I'm getting the question right, which is just basically, or if you feel more comfortable, and some therapists do, just creating separate charts. But then I don't know how that really works in terms of just the daily wanting that information all together in one place.
And with SimplePractice, if you're using SimplePractice as your EHR, we recently made an update where you can have a couples account. It becomes a couples chart, and you identify the patient, and you can control access to the client's portal so that all that information is saved under one record.
Yeah.
All right, and then last thing here is if you are not currently using SimplePractice, as I mentioned, we've recently made some updates that make it really easy to use for couples therapy in terms of charting and billing insurance. So get started today with a free 30-day trial. Just go to simplepractice.com, no credit card required. And if you have friends that are using it, ask them to send you a referral, or anyone that is currently using SimplePractice, feel free to invite your other clinical friends and sign up with a $50 credit. Thank you everyone for joining us today. And thank you so much, Barbara, for this very valuable information. I hope everyone has a great afternoon.
Bye, everyone.